in every 4 of us. So they include things like cardiovascular disease, cancers, respiratory diseases, and diabetes. They can be a result of a combination of genetic, physiological, environmental, and behavioral factors, meaning there's a whole range of options to try and tackle them. The best way to go about that is what we're going to be discussing over the next 45 minutes or so with the panelists. And I'd like to remind everyone to talk about the summit on social media using our hashtag #PoliticoHealthcare. So yeah, I'd like to welcome our speakers. Next to me we have Michele Cecchini, Public Health Lead at the OECD. We also have Professor Loic Josserand, President at the French Alliance Against Tobacco. And next to him we have Dr. Marcus Koch, Head of Oncology in Europe at Daiichi. So we should also say that unfortunately the MEP Marta Tomido is not able to join us today, but that does mean that we'll have a bit of extra time for Q&A, so do start having a think about those if you're here in the audience today. So yeah, as I said, NCDs are so all-encompassing and can include all kinds of things from mental health, diabetes, cancer, and for some of these we've got like very specific strategies like the Beating Cancer Plan, mental health strategy coming out from the Commission shortly, the cardiovascular plan too. And I was wondering, obviously with the start of the new Commission mandate, I wanted to ask each of you, is there one specific thing that you'd like to see from the EU or that you'd like to prioritise when it comes to tackling NCDs? Perhaps I can come to you first.
Absolutely, thanks. Good afternoon, everyone. It's a pleasure to be here. Getting to your question, clearly NCDs, as you said, play a very important role in both the health of European population, but also in terms of the economy, and that's the reason why OECD is so interested in NCDs. One thing that is coming out is that we are on a path in which, for example, for cancer, one of the leading NCDs, the future is not sustainable for our healthcare systems. We want to invest more in access and screening and high-quality treatment. And to do this, and to maintain our healthcare spending on a sustainable path, we need to invest on prevention. Prevention is the only way that helps us curbing this cost before they happen, and they allow us to invest our resources on those that are really need. Therefore, my answer is to continue and even more invest on prevention. Various types. Clearly, if we look at the top priorities, tobacco is our first cause of burden, diet and overweight. Second one, number 3, alcohol. Number 4, pollution. These are my priorities. What about yourself?
Thank you for asking, and I'm very pleased to be here too, of course. Of course, we are waiting a lot of the at the European level. Of course, because all of the action we have to organize, we have to do, is first of all political action. Everything is from this level. Without this level, we can do everything. We can do, of course, we can sell, nicotine replacement therapy. We can do a lot, but not enough to have a good, effective prevention, and most particularly among the youth. Because this should be the absolute goal for all of us, the youth, and we should fight for the health of the youth and for the health of the next generation. Because all the lobbyists, maybe there are some of you here about tobacco, all the lobbyists try all the time, try to seek and to catch new consumers. That's it's the only goal they have. I'm sorry, I'm from the civil society. I'm also a physician at the hospital, at the university, etc. But in this role of civil society, the goal of the European Union is to protect the next generation and to protect the youth right now. Not today, today, not tomorrow, not the next month, today. They have this role to play right now. If they don't, we fail. And we condemn right now. We know that today in France and at the European level, some youth are going to smoke for the first time today. That's not acceptable. Then we know in 30 or 40 years, they will die of the behavior they gain today. So we have to fight for this and for the health of them for tomorrow.
Marcus, what about yourself? Where would you kind of prioritize if you were the European Commission? What would you like to see them prioritize when it comes to tackling NCDs?
Yeah, thanks for having me, first of all. Great question and also a great opening. I think reminding us that 3 out of 4 people will die by a non-communicable disease, like basically cardiovascular and cancer. These are the big killers. And look, every second in this room will face the diagnosis of a malignant disease in his or her lifetime. So there is urgency, as we heard earlier in the panel. That is important to put it on the agenda. That will be my first ask, that it is really specifically cancer, but of course also cardiovascular disease, that it becomes or stays on the agenda as a top priority. I think that is important to drive any change. And then I think there is good, and you mentioned some, there's good initiatives on the way. It is understood the Beating Cancer Plan is a very good initiative, and I fully support the focus on prevention. I would probably, and tobacco is a no-brainer, and it's sad to see so little progress, given it is so simple and straightforward, actually. But beyond this, I would probably broaden the focus a little bit to also secondary prevention. I think we need earlier detection. We need more personalized therapies. So prevention and care, I think, is a continuum that we need to both drive and foster and put on the agenda, because the progress that we have seen in the last 20 years, and I'm also a physician. I worked 10 years in an academic hospital, and I remember 20 years back, like advanced cancer meant patients would die relatively quickly. Now we have, even for more advanced cancer stages, we have survival rates, 5-year survival rates in breast cancer, in prostate, even melanoma of 90% plus. And I think that's a great success that should encourage us to take a more holistic approach to this, and double downing on prevention does make perfect sense, my full support, but being more holistic in this, more coordinated across Europe, where we have so many positive examples, that would be my ask.
Just obviously you mentioned prevention there, and that's the focus of the panel now, and I'm just wondering, obviously one way of measuring prevention is looking at how much government spend on it, and typically it's something like 3 to 4% of health funding goes towards preventative care, despite the fact it's generally seen as a kind of good return on investment or saves money further down the line. I was just wondering, maybe to come to you, Marcus, specifically, what do you make of that argument that perhaps more funding should be sort of diverted to preventative health measures?
Yeah, I think, look, there is no doubt, and the WHO has been very clearly showing this, prevention is super cost efficient. It's well invested, and it returns in multiples, no doubt. But the same is true also for, let's say, secondary prevention. As I said, earlier protection, screening programs. That is actually also that increases not only outcomes and gives you a chance to cure, or at least turning your disease into a chronic disease, if we speak about a malignant diagnosis. It's also very, very cost efficient in treating a disease early with the right personalized approach, and stopping it before it becomes worse and more expensive to society as well.
One of the reasons, obviously, we're so interested in talking about NCDs at the moment is not just because so many of us are affected by them, but because potentially the burden is only likely to get worse. We're living longer, we have an aging population, as you know, but we're also sicker than previous generations. So would you say, Michele, our public health systems in Europe are able to cope with the weight and cost of NCDs at the moment?
No, I don't think that we are on a trajectory, as alluded in my first answer, on which we can afford the rising cost of NCDs. For the very same reason that you say, that there is an aging population, therefore higher incidence of NCDs is ahead of us. Cost per treatment is also going up. So we are having better health outcomes for the treated, and the colleagues on the stage have mentioned some of the achievement, but this also means that we pay a higher cost for treating these persons. Therefore, as I said, the only way that I see forward is to invest on prevention, and if I can take another couple of seconds, we are spending too little on prevention currently. The latest estimates that we released 2 days ago on Monday, show that across European countries, the part of the healthcare budget that is spent on prevention is around 4%. It's a little bit higher compared to the period before COVID. It's definitely much lower compared to the COVID period when clearly we spent a lot on vaccination, surveillance, and tracking and tracing. There are ways to mobilize more funding for prevention, and perhaps we'll have the opportunity to talk about it.
I mean, on that point, I kind of wanted to talk about the political dimension. Whenever we've spoken with researchers about prevention spending in the past, they've suggested that one of the reasons policymakers might not necessarily want to invest in them is because it's not necessarily politically savvy. You might be essentially handing over, political capital to your opponent who comes into office several years down the line, to see the results that you put the money into. I think we were speaking with one researcher the other day who said it's much more politically savvy to build a new hospital rather than try and keep people out of hospital in the first place. Loic, I know you've worked in the past as a kind of technical advisor to governments. I'm just wondering, would prevention strategies be something that you'd recommend to those hoping to stay in office for that reason? Or is it too cynical to suggest that it's not politically savvy to invest in prevention?
Sorry, I have some difficulty to hear you. I'm sorry. But
Okay. I was just going to ask, on the political side of things, perhaps sometimes it's not necessarily seen as very savvy to invest in prevention because it's such a long-term, issue. You don't see the results straight away. Is that something that you found when you were, advising? I think you worked with the French Health Ministry. Would there be these conversations around prevention, and would it be seen as a kind of politically unsavvy thing to do?
now, prevention is a long time. It takes time, of course. We know that what we are doing right now should be effective in maybe 20, 40 years at least. And we also know that if we put €1 today, we gain €4 in the coming years. So that's very cost effective. So it's why we have to do this, and it's why we have to go in this prevention, and it's long-time prevention. But it's necessary to be brave today, because we are facing a very strong lobby, in fact, in face of us. They are very strong. We know that some measures are very, very effective. We know that tobacco taxation is very effective, and that we need some a regular and sustainable and a trajectory for taxation. That's really necessary. It's at least 10% per year if we want to be effective. 10% per year means that the consumption will be reduced by 4% in the coming years. So we know it's very effective. For example, at the French level, we ask for a price of €16 per pack of 20 cigarettes in 27. We know that we are not on this trajectory. We know we're going to fail this. There is also some very effective and scientific proven strategies that could be very effective, that we have the regulation of new product on the market. But at this time, we are waiting for it. Of course, controlling access to the product for the use, that is also one of the most effective measure of prevention that we should adopt. Banning smoking or vaping in public place. We should enlarge the number of places where this should be banned. And of course, facilitating the access to nicotine replacement therapy. All of this are prevention, are very efficient, are scientific proven as efficient, and we should adopt and we should implement this strategy. That's very important.
One of the big NCDs is obviously diabetes, and obesity is one of the big risk factors for NCDs. Obviously, in recent years, one of the most significant advancements we've seen in health potentially is Ozempic to treat those kind of conditions. And we've also seen some governments make the most of these. I'm thinking, obviously, I'm from the UK, and saw recently the UK introduce a trial to provide jabs to people to try and get them back into work. I wouldn't necessarily describe this obviously as a quick fix, but I'm wondering, do you foresee a move away from prevention and towards a more treatment-based option? Maybe Marcus.
Oh, it's a good question. It's not an easy one. Look, I believe you mentioned diabetes clearly. Also there, the evidence is straightforward, but changing lifestyle is tricky, and we know health literacy is important, the motivation is important, of course, the understanding as well. There is a lot you can do via lifestyle modifying prevention measures. Tobacco, certainly one example, but also more physical activity, fighting obesity. I believe, yes, for some patients, or let's say people, Ozempic or other strategies that are involving in making it easier and more efficient to control weight might be a shortcut, let's say. Yeah, I personally believe that that could be one path forward in making it just easier for people who want to change but find it difficult, even with all the encouraging and primary prevention measures. And there is more we can do for sure. Yes, I believe there is an opportunity, I would say, long term. And I'm sure, and again, I have no personal interest in that or other drugs in that area, but I think that could be also a very cost-efficient intervention moving forward, because we know NCD's diabetes is it costs lots of life years, but also the system a lot of money in then like caring for all the complications that come with advanced diabetes. Yeah.
As I mentioned at the top there, obviously we're seeing so many different ways of tackling NCDs because there's so many different kinds. But I just wondered, Michele, if you have seen any kind of good examples of good practice when it comes to prevention. I think sometimes maybe we focus too much on the fact that not much work's being done. So are you seeing any good national examples or at an EU level that you'd like to highlight as potential models to follow?
Yes, absolutely. This is a line of work that OECD has been investing a lot with the support of the European Union. We are helping countries in transferring, first in identifying and then transferring best practices for prevention across countries. And countries are testing more and more, particularly a part of joint action. There are two that are ongoing across the European Union. One is called Joint Action Prevent NCD, another Jacardi. They are testing together hundreds of potential best practices. Some have already been identified. Prescription of physical activity by primary care doctors, just to mention one. There are some very interesting food labeling examples. France, Belgium, other countries across the Europe have implemented the Nutri-Score, and there is ongoing discussion, possibly not proceeding as quickly as the public health community would like to see, to extend it and making European-wide. Intervention from Iceland on improving physical activity across elderly population to prevent Alzheimer's diseases, but also to keep them in good shape and active. There are some. One that I would like to mention is one implemented in Finland, because what we have identified is many of these best practices do not necessarily look at very specific population groups. And instead, Finland have tried to do the extra step. They have a program to prevent diabetes that is rolled out nationwide, and they have made the efforts to try to adapt it to a minority group, the Somali population in Finland, which is the biggest minority group in the country, and they adapted this intervention for this very specific group, for the type of diet that they have, the type of lifestyle that they have, and it showed as an interesting example on how they managed to collaborate with the group, also to move from the population-wide to the specific groups.
I mean, lots of these examples focus on things like lifestyle choices. Do you think we should be taking things like environmental factors or social determinants into account more, or are there examples of that across Europe potentially?
Absolutely, for a number of different reasons. First of all, there is a lot of discussion in the public health community on what are called population-wide intervention, including the environmental that you mentioned, versus individual-specific population. I'm thinking about, for example, counseling in primary care. They have both pros and cons. One of the advantages of this population-wide is that they tend to be more affordable, cheaper if you want, at the population level. They target a broader group of population. A second advantage is that, and it goes back to the point I was making before, is that you can mobilize resources from other sectors that are not necessarily the health sector. And let me give you a practical example. We are working with a number of communities to look at how reshaping the urban environment has an impact on the lifestyle of persons. For example, promoting active travel, but also decreasing the temperature during the summer. We know that heat waves are going to become more common, and these have an impact on cardiovascular diseases, cardiovascular diseases, COPD, particularly for elderly population. Modifying the urban environment is something that, in terms of budget, goes beyond the Minister of Health. It's not the Minister of Health that puts the money to reshape the urban environment, but if well designed, these interventions have a significant impact on population health. So in a way, you are able to mobilize extra resources. It's very important that this intervention involve the Ministries of Health at the local level, local health authorities, for example, to maximize this impact at no extra cost. There are examples. The city of New York is trying to do it. In Europe, there are examples in the Netherlands, Utrecht City, I'm thinking, Barcelona, that are following this approach.
Loic, obviously I know one of your focuses on NCDs would be action on tobacco, smoking legislation, and indeed when you look at what the Commission plans to do on NCDs, it highlights exactly these tobacco legislation. We know, obviously, we don't have anyone here from the Commission to kind of give their perspective on the delays that delays to the legislation that's meant to be put forward already. But whenever we've asked them about this, often their response is around kind of the changing market. They say they need to do kind of more research in this area to fully understand before they introduce new legislation. When you speak with the Commission, what kind of response do they give you to kind of explain the delays to this legislation?
We always, and it's true everywhere, that's a pity in fact, not only at the European Commission, but it's also true at the French level. We always have to explain why what we are doing, it's healthy. What we are doing is very important. Because, I'm sorry, I said it again, we have to face a very strong lobby, which is very, very efficient. And we have everywhere a very strong porosity between stakeholders and tobacco industry and tobacco allies everywhere. And just for example, this porosity was highlighted by the European Ombudsman in 2023. That's a pity. It's true also at the French level. And we have to fight them all the time. This morning, we talk about virus, we talk about AMR, but there is no lobby for virus, there is no lobby for AMR. So I don't say that easy to fight virus and AMR, I know what I said. But we have also to fight this effect. And I'm sorry, the outbreak of smoking, of NCD, it's transmitted by these lobbyists, by this non-political action. This is that, and we have all the time to try to convince the European, the Parliament at the European level, at the French level, or with colleagues, we talk about this in other countries. All the time we have the same difficulties. This industry, this tobacco industry is able to renew it all the time with new products. And we know that they are always ahead from us. They are always with a new product that we are not thinking about it, and too late. It's already on the market. And it's why now we know how we do not have to face the tobacco market like we know it for decades. It's not only cigarettes. Now we are talking about puff, about e-cigarettes, about nicotine pouch, about gummy bears, about everything, snus, etc., etc. So it's quite impossible to fight all of these products in the same time. So it's why we need to get a very strong regulation to help them to fight this product before they are coming on the market. Because once they are on the market, it's the end. And it could be very difficult. For example, in France, we now get the ban of puff bar. It took maybe less than 1 year to get it in France, to get the law. But to have the application, to put in action the law, it takes 1 extra year. That means 2 years, at least 2 years. it's too late. Because how many youth started with this product? How many of them? So we have to get this very strong regulation and to ban product. And now I said it's not only tobacco market, it's nicotine market. And this is quite different. And it's still the same industry behind this market. Always the same, always, always. So we have to work on this very, very, very efficiently. And the other side is about taxation. I'm sorry, I always speak about taxation, but taxation is very important. It's one of the most effective tools to fight again for tobacco control. And it's also, at the European level, it's quite difficult to have an harmonization or something like this. And then it's very useful for lobbyists and for tobacco industry to use this argument to say, hey, be careful, you don't have to increase your the tax in your country, because if you increase it, wow, what will happen? All your consumers will cross the border, and then they are going to buy the cigarettes outside the country. So you're going to lose money. So don't increase taxation. Don't. It's dangerous for you. No, it's not dangerous for the country. It's dangerous for the public health. It's dangerous for the youth, because smoking is just a big loss of money for the countries, all the countries.
Staying on legislation, obviously one area on NCDs that the Commission has worked on recently or acted on is the Beating Cancer Plan. So I'm just wondering from yourself, what do you make of the EU's approach to cancer initiatives, and are there any gaps in the legislation, things you'd like to have seen that haven't been implemented, or how would you assess the implementation so far?
Yeah, I think the Beating Cancer Plan is the right path forward. I think it's working well. Implementation, as we heard in the last panel, is a key element, and we are certainly not yet there, but I think directionally that's correct, I would say, and we can do more. I think as I said earlier, what we need more, and the Beating Cancer Plan can contribute there, is really coordinating the efforts and really looking holistically at the whole picture, like including the environmental changes needed, including taxation, including other primary prevention measures, but also looking holistically at NCDs, including care, including secondary prevention. I always find initiatives most inspiring that actually foster or force collaboration beyond sectors, where partners from different stakeholder groups come together and look at this. And one example, since you asked initially for an example, that I believe is really been impactful is it's a German one in this regard, Vision Zero Cancer. You might know it's a think tank actually, and it's close to my heart because I was one of the founders 5 years back, but there is politics, stakeholders, academia, patients, and also industry, like research institutions coming together and looking at what needs to be done across the whole journey, let's say. And there is a strong focus on prevention, of course, for obvious reason, but what needs to be done in each step of care, of secondary, primary prevention, and more tailored treatments to make sure there is zero unnecessary cancer death. And it is inspired by a Vision Zero initiative that comes from the Nordics. I think it was Sweden 20 years back or so, where they looked at death in traffic, and they tried to holistically change everything from technical details to education in school around traffic lights, to make sure there is zero traffic deaths. They are not yet there, but I think they have been able to reduce death by cars by 70%, which is impactful, I think. By aiming at 100%, I think they have really delivered, and I hope we can do something similar. And again, the secret is, I think, bringing partners together with the same purpose and intention from different sectors, and that is working there. I think the EU is the perfect place to foster that collaboration. And there's good initiatives. There's Jane 2, that also looks at building more networks across experts and across different sectors. So I would say the Beating Cancer Plan is great, but we are not yet there.
I wanted to open up the floor now to questions. I don't know if there's anyone in the audience who has I see a gentleman there. Do we have the roving mic, maybe? And we'd obviously just ask you to keep the questions reasonably snappy, explain who you are and who the question would be for. There should be like a spotlight coming down on you, but
Snappy
do we have it?
questions.
Yeah, this chap here, just in the front, yeah.
Okay, thanks for the interesting discussion. My name is Ian Marnane. I'm from the European Environment Agency in Copenhagen. It was good to see mention of the environment, and I think from our perspective, just a very quick comment that we see that over 1/3 of respiratory deaths are related to environmental risk factors and around 20% of cardiovascular deaths. So we're keen to promote the importance of that. But my question really to the panel is what do you think the awareness levels are in the health sector in relation to the importance of environmental risk factors, and how can we increase that awareness? Because we think it's somewhere where the deaths are largely preventable through reducing pollution. So interesting to hear comment on that. Thank you.
Thanks. Anyone like to take that?
Who wants to take that snappy question?
I'm happy
Sure.
Yeah.
to have a try. I would divide the health sector into different subsectors, probably in responding to my answer. My interaction with national level policymakers, those that show up at the OECD and we work with, I think are now relatively well aware of the impact of the broader environment on health. We have started, for example, a couple of years ago, data collection on how heat waves impact access to healthcare services. We have started developing indicators to monitor this on the request of countries, meaning that they are aware. I'm probably, as the colleagues, I'm also originally a medical doctor by background, although then my path took a different way. But I still interact a lot with friends in the medical sector that work in hospital at the ground level. On that part, probably awareness is a little bit behind compared to the central level policymakers. I think that they need to better understand what are the implications of the environmental changes we are going through, because it will have inevitably an impact on the medical practice. There are various tools that we can use. Now I'm brainstorming with you, but for example, across Europe, doctors have to attend continual medical education programs to stay up to date. They need to do a number of credits per year. That could be a way to reach them and to increase awareness of this problem.
Yeah, just maybe, yes, a comment. I agree with you. This argument works very good with youth in terms of prevention, because tobacco industry is one of the major actors of climate change because of deforestation, because of green gas production. So the new generation is very sensible. It feel this change very, very well. So they are very not happy. They are very sorry, I missed the word. So they like this argument, and it's very effective when we are talking with them with this aspect of try to not smoking, because when you smoke, you destroy also the environment here, but also where the tobacco is growing. So that's very important for them to understand this aspect. And in terms of prevention, it's very, very efficient.
Okay, did you want to come in on that, or? Yeah.
Look, I can only agree and echo. And one element that hasn't come up, but which is also environmental, and I think an important but very long-term measure, is the way how we build our cities, actually. What the environment in terms of fostering, and look, the heat waves have been mentioned clearly. There is a link between urbanization as we see it and the shift from communicable to NCDs now. And look how we build our cities. Do we encourage commute in a not only ecologically friendly but also activity enhancing way has a huge influence. And there's good data showing that the way you live and the way the environment is built by stakeholders, by architects, by the cities is having a huge influence, not only on access to healthcare, but also on lifestyle.
Thank you. I think, did we have a question here from this woman? Yeah, do we have our mic? I don't. Oh, thank you. Cheers.
Thank you. I'm Rana Orhan-Pace. I work at Ecors. That's an international research consultancy firm. We've talked about prevention strategies, I mean, for many, many years. You've mentioned as well they're effective and efficient. A recent study commissioned by the Dutch government also shows that for health taxes on unhealthy foods, so sugary foods specifically, brings gains of 1.1 billion euros per year for the Netherlands. That's a massive amount if you compare it with, for example, the EU for Health budget, which for 7 years, just 4 times more. I'm wondering if the public health community should work more on a narrative and maybe change a bit more towards these financial numbers, which may convince politicians a bit more, because I've worked in the public health community and I feel like the health argument is sometimes not appealing to some politicians. So I think that's a question for all. Thank you.
Anyone dying to take that?
You pick one.
You're being
and
okay,
I'm happy to
Michele. I'm going to
start,
start with you. I'm going to just go in this order from now on. Sorry.
Okay. Well, definitely. We know that taxation is among the most effective and cost-effective intervention, and there's also the side effect, the potential positive side effect of helping countries raising money, and some of the countries use this money to reinvest on prevention. So in a way, it's a multiplicative effect, if you want. On certain areas, tobacco, for example, I think that the use of taxation is now given for granted. There is, of course, a lot of work to do. I agree. No later than 2 weeks ago, we launched a publication on, and we have a program to help countries implementing best practices on taxation for tobacco. Alcohol, there is a little bit, it's more problematic in certain ways. There is WHO, for example, that advocates, and I think it's a good idea, for having a taxation based on the unit of alcohol within products and not on the type of products. Certain European countries, for example, have very low level of taxation, if any at all, on wine, and the quantity of alcohol in the product, I think, is the way forward for public health reasons to tax this type of product. It's even more complex when it comes to taxation on food. And there are different views. It's more difficult, first of all, because it's more difficult to identify a tax that exclusively hit certain types of food. Sugar is the very classical example. There are countries that now are thinking about, for example, linking it not to the nutrient, but to the type of label. So that's, for example, what Chile is thinking, but other countries as well. Or, for example, on the level of processing of the food. Much more complex, but yes, we know that ultra-processed food is not good for your health as eating fruit and vegetables. For me, together with taxation, rising taxes, another thing to consider is decreasing incentives that are provided currently into various forms for products that are not healthy. Because on the one hand, we are subsidizing the production of certain products, fundamentally helping producers lowering the cost of this product. On the other, we are trying to tax more them. I think decreasing the economic incentives for an healthy product should go hand in hand with taxation. And this one, from selling the message to the broader public, is probably easier than the taxation itself, which is not saying that we shouldn't continue having taxation as one of the multiple interventions we need to put in place.
I think it's a great example of, I couldn't agree more. Taxation is effective, but it alone will probably not do the trick. I like and also on food, of course, you need to be able to afford healthy food. That's simple, but I liked also the comment that, especially to younger people, often arguments of reason and of health alone are not compelling enough, they are not attractive enough. And when it comes to smoking, we see this. It's irrational, they know this, they still do it. I've seen a very appealing digital initiative recently in Germany where somebody built an app, an app-based app, where you can, like, based on your picture, on your photograph, the app shows you how you will look in 10 years if you smoke or if you don't smoke. Of course, it's a little bit, obviously they overdo it a little bit, but you see, you don't age that well if you keep on smoking. And apparently, like in their data, it seems to have quite an effect, especially on young people, because they might still be able to afford cigarettes, but they certainly care for how they look now and in 10 years. So I don't know, it's just one little example where the right narrative and an innovative idea, like here digitally based, can make a difference in how we like pull all the bottoms, including taxation, to make smoking less attractive.
Loic, any final thoughts?
Yes, taxation, of course, for smoking prevention, of course, is one of the tools, but it's only one among others. It's one of the most effective, of course, but it's one among others, and then we have to now work. Maybe as the example is coming maybe from UK with the generational ban, which is maybe a very interesting solution. Some countries have already had this debate, and maybe at the European level, it should be interesting to go to this idea. It should be maybe interesting. I think it may be something very effective if we want to have a real smoke-free generation in the coming years. And I agree with what Michele said previously about the Nutri-Score, which is very effective in France. It's and people like it. But in the same time, and I'm sorry, I'm going to talk about again about lobby, but the French tobacco lobby for food industry are against this Nutri-Score, which is very interesting and very informative for publics, and it's difficult right now to maintain this Nutri-Score on the product. So this lobby is very effective in tobacco, in all tobacco industry, food industry, sugar industry, alcohol industry. They are always trying to fight again all the effective solution. And if they fight one solution, you can say that this solution is effective.
Thank you all. Thank you very much for your questions. I think that's all we have time for. Thank you to all of our speakers for joining us here today. It's been a really interesting discussion. I'd now like to inform everyone that lunch is served in the main networking space until 2:15, and you can also participate in a standing yoga session there at 1:45, where there'll be some gentle breathing and standing exercises. Oh, that's in here, actually, sorry, yeah, if you want to get involved in that. Thank you, everyone. Cheers. Thank you. Cheers. Nice to meet you. Yeah, how are you doing?
We are united in diversity. We are very heterogeneous in our opinion.
If we do not renew our partnerships with the rest of the world, Europe will not be relevant.
We can make it if we are together as Europeans.
And looking ahead to what is next.
Do you genuinely believe that countries will manage to reach these very ambitious targets?